Hello everyone, welcome to Heal Your Heart EECP Treatment Center. In many of my previous videos, I have clearly mentioned that bypass surgery or angioplasty may not able to prolong your life or prevent a heart attack. If it is so, then the next question is why these highly invasive procedures were not able to prevent a heart attack or prolong your life. If you want to understand in depth, then you should know about what is heart attack. So usually the belief is heart attack is when you have a heart muscle damaged by lack of blood flow. But let us go in depth to find out what actually leads to a heart attack. So heart attack can be divided into two major parts. The first part is demand oriented. It means let's assume you have a blockage in the blood vessel carrying blood to your heart muscle. It's a coronary artery. So in the coronary artery, you may develop a block when you are young itself. Let's say in 45 years you have a block of around 20%, then it slowly grows. By the time you reach around 65-68 age, your block might have come up to 70%. But in spite of that, there might be only a small reduction of blood flow. Let us say around 15 to 20% of reduction in blood flow. So this did not give you any symptoms. So you were able to do your routine activity, no discomfort, no chest pain or shortness of breath. Then suddenly one day you got a heart attack. So the question arises from everybody's mind is, if I have this block for such a long time, why did I get a heart attack now? Now the answer lies in what we call exertion. Many times we are used to our routine activity. For some of them, the routine activity is walking around 2 to 3 kilometers, but some of them the routine activity is only around like walking 10 to 15 minutes or just climbing some staircase inside the house, not much more. Now, when you stepped out of this routine activity, let's say suddenly you are in an emotional stress or you are trying to run and catch a train or a bus, this is outside your routine activity. Now, the blood supply, as I said, it is only 15 to 20% deficiency. Suddenly the deficiencies goes very high because your heart is demanding more blood supply and your vessels, which is blocked, not able to provide that much blood as it's supposed to be giving if it is not blocked at all. So this creates what we call as a deficiency of blood flow, and if it is severe, you get a heart attack. So this is demand oriented heart attack. Now the second type of heart attack is plate disruption. So what is this plate disruption? Now the same patient, he is having a blockage of let's say 70 to 80%, he has no symptoms, is doing all his activity, and suddenly one day he got a heart attack. But he will vouch to you saying, no, I did not do anything out of ordinary or exert myself, in spite of that I got a heart attack. Now this is called plate disruption. Here what happened is, this this block, which is around 70 to 80%, is disrupted or it is broken. Once it is broken, the small pieces will travel along your major artery and then end up into a small artery where it causes a 100% blockage and causes a massive or a mild heart attack. So this is called plaque disruption heart attack. At the same time, when the plaque is disrupted, there is a raw area. Then what your body does is it actively tries to heal that part. So it forms a clot. When this clot is formed on the raw area, what will happen? The 70 to 80% block suddenly become a 100% block because of the clot, and this causes a heart attack. Now this two heart attack has to be remembered for you to explain why bypass surgery and angioplasty is mostly ineffective to prevent heart attack and death. Now let us go and see what bypass surgery really does to prevent heart attack or death, which is an assumption which is not been proven by science, but this was an assumption which has been carried out for a very long time. And now I am going to explain to you why it does not prevent heart attack and death. Now during a bypass surgery, what they will do, they will graft or detour the blood flow across the blocked artery by putting a graft. This graft can come from your chest, or it come from your leg or your arm. So once this graft is placed, it can able to bring the blood across the blocked artery and deliver to the distal part of the artery, so the blood flow is restored. Now As far as the bypass surgery is concerned, the blood flow is completely restored by the new graft they placed across the blocked artery. But now if you look at the definition of heart attack, the second part, plaque disruption, the block remains where it is even now after bypass surgery. So if it is again disrupted, the patient is exposed to the same risk of heart attack even after bypass surgery. Now the first heart attack which I explained, demand. Now because bypass surgery is able to give a blood flow across the blocked artery, sometimes it may have an ability to reduce your chances of the first heart attack, which is a demand oriented heart attack. But in this case also it is disputable. The reason is, when you are from 45 to almost 65 years, your body would have naturally tried to overcome this blocked artery by forming lot of small collateral channels. This natural collateral channel, once you put an artificial graft, will close, because the blood is going to go through the new vessel which you have created artificially. So it is a challenge against natural blood flow and artificial blood flow. So overall what will happen is, when this collateral circulation closes, again you are predisposed to getting a heart attack later because of the demand oriented heart attack. So overall, bypass surgery may try to increase your blood supply and reduce a symptom, and because of this two type of heart attack, probably it may not able to prevent a heart attack. Now let us go to an angioplasty. Now what does angioplasty really does? Angioplasty is a way of opening the vessel by putting a kind of a wire mesh. So the wire mesh is inserted. Here the blocks are not removed, they are compressed against the vessel wall. Once it is compressed against the vessel wall, the blood is able to pass through the blocked artery. But remember, again the block which has been compressed can regrow inside the stent, and now you are exposed to the same risk of disruption of the plaque or the first heart attack because of the lack of blood flow. Now even angioplasty, it is going to interfere with your natural collaterals. So that is why many times people who are able to walk good distance, after stent they may experience some discomfort, because again I would say it is a challenge between natural collateral which is able to increase the blood flow to the heart muscle versus a newly formed opened vessel mechanically done by artificial means. So overall, when all the risks are put together, you should also remember bypass and angioplasty are the two procedures which itself can create a risk, which is called procedural risk. So overall, when you compute for a 5 years or 10 years follow-up study, this bypass and angioplasty will not able to prevent a heart attack or prolong your life. So this is a reason we are clearly saying bypass and angioplasty should be given only as a last resort when the quality of life or chest pain is severe. Before that, we should utilize all the treatment which can enhance your collateral, and EECP is one of the foremost treatment which has proven to improve your collateral without putting the patient at any risk. இருதய நோயாளிக்கு வந்து பைபாஸ் சர்ஜரி ஆஞ்சியோபிளாஸ்டி சிகிச்சை முறை தான் முன்னாடி கொடுக்கப்பட்டுள்ளது. இதற்கான மாற்று சிகிச்சை முறை வந்து EECP, Enhanced External Counter Pulsation, Heal Your Heart Vaso-Meditech EECP Treatment Center.